Senator Paterson.
Thank you, Chair. Mr Gaetjens, to you first, because I understand your time is limited this morning. I've just got a couple of questions about the National COVID-19 Coordination Commission. Obviously, it's a fairly high-powered collection of individuals, and these are all people who have other things that they do in their lives. They run businesses, they sit on boards, they work for other organisations. Given that there's obviously opportunities for conflicts to arise, what mechanisms does the Commission have in place to manage those conflicts?
It's not just mechanisms that the Commission has in place, they have been subject to the processes that PM&C applies to actually getting declarations of interests in that process. Stephanie Foster will have the details on that, but suffice to say they have gone through a rigorous declaration of interests process, and I don't know whether, Peter, you want to say anything on this, but they have been declared. I'm pretty sure, and you can check this later with Ms Foster, but I'm pretty sure that they have indicated that they will not use information that they gain from this process to personally benefit them. I think they have been, again, they are an advisory body, not a decision-making body. And lastly, I think from my own perspective, having attended most of the meetings of the Commission, they are a very informed group. They are using their connections to the benefit of providing the government with information that is relevant to particular issues that are affecting the economy because of either businesses having to close or, in fact, recently they've spent a lot of time on trying to work out how, with businesses and with government through the the Australian Safety, what's the name of the body? The Commonwealth body that deals with state and territory workplace health. Safe Work Australia, that works with the state and territory work health and safety regulators to get advice in a usable form to provide to businesses to how do they open up, what process do they do in terms of opening up in a COVID-safe way. So they have been able to bring a practical business perspective to meet with the requirements of government to put out guidance to help most people, and I think they have been a very useful body.
Okay, thank you, Mr Gaetjens. We may return to that with Ms Foster later in your absence. Turning to you, Professor Murphy, there's been reports in the media here in Australia but also internationally over the last few days about a possible, I don't want to use the wrong medical term here, so please correct me, but a mutation of the coronavirus in the way that affects children. It's being referred to as a Kawasaki-like disease. Do you have anything you can share with us about your understanding of it?
Thanks, Senator. So I don't think it's related to a mutation of the virus. The virus does have some mutations and they're being studied, but they're not at this stage seen to be significant. Kawasaki disease is a rare disease in children. We see a couple of hundred cases a year in Australia. In those countries where there's been a huge volume of infection, US and the UK, now, we know that less than 2% of COVID-19 cases are in children. It's very rare that children are infected, but when you have millions of the population infected, there are obviously more children, and there does seem to be an association between an increased incidence of this condition and potentially COVID-positive children. It's probably a reflection of probably in New York City, for example, there are likely to be several thousand children infected because you're dealing with potentially hundreds of thousands of people. So it's a very, very rare association where it's not clear. Kawasaki disease can be set off by other viral infections. We don't know whether these children have a predisposition and it's just been exposed. We haven't seen any cases in Australia, and the expert group we've got looking at it thinks it's unlikely that we will because of the very low total number of infection and, of course, the very, very low volume of infected children. I think it's been less than 100 children under 10 that have been infected in Australia.
Okay. So this is being looked at, but from your preliminary view, this is not likely to be a problem in Australia as it has been elsewhere.
We don't think so, but we think that it's one of those rare things that has emerged because of the huge burden of the infected load in those countries. It may appear in other countries with very large volumes of infected people, but because it's so rare, it's unlikely to be seen in Australia. But we've got alerts on it and we're clearly watching it.
Okay, thank you. I want to turn now to the national roadmap with the states for easing restrictions, and particularly interested in, as you've previously given evidence to this committee, one of the most successful interventions the government has made in this crisis so far has been closing the borders. And I think looking at the modelling that you've released through the Doherty Institute, really bears that out. In most states and territories, the effective reproduction number was below 1 quite early. In some states and territories as early as early March, some of the other states and territories in the middle of March, with the exception of Tasmania, which had that later breakout. Given the lag time for measures to have effect in the numbers of the reproduction number, should that give states confidence in easing these restrictions, that the most successful intervention was closing the borders? No one's proposing to change that anytime soon. Mm-hmm. The other measures that they introduced afterwards, while maybe helpful, probably weren't as critical as that, and so they should have some confidence in easing.
Look, I think the border measures will be in for the foreseeable future, and there's no question that whilst there's large volumes of cases in other countries, that is one of our single most important measures. Nevertheless, when we introduced the physical distancing measures, there was significant community transmission in Australia. It was much less than overseas acquired, which has always predominated, and there's no doubt in my mind that those distancing measures did help to control that community transmission, and that was an important part of it. Now we've got cases of around 20 or just over 20 or under 20 a day at the moment, but there is still some limited community transmission. So of course, keeping the border measures will give states confidence, and I think what will give them more confidence is watching what happens 2 to 4 weeks after the easing of restrictions. So they're cautious first steps, but I think if we don't get significant community transmission or significant outbreaks, we will get outbreaks, because we know this virus is still present in the community, certainly in the eastern seaboard states and likely elsewhere, but we're well prepared to respond. So I think the states and territories are very closely looking at these first steps of relaxation. If we are in the same good place in a month, I'm very confident that they will continue to progressively relax the restrictions.
As you indicate there, not only do we have a good handle on which measures were more effective or less effective, but we've also got a good idea about how to respond, and we've got a much better oiled machine for the tracking and the tracing and the treatment. We've got the increased ICU bed capacity, increased ventilator capacity, yep. And we've had a couple of trial runs of Northwest Tasmania and Cedar Meats of how to respond to these. Sure. So you're very confident that this roadmap, can be followed with confidence. There's no need for extra caution beyond that national roadmap?
Look, I think, Senator, nobody in the world knows the road out of this. We're one of a small group of countries who are in a really good place. The National Cabinet was, and the Premiers and the PM were very, very keen for us to reassure them that we were well prepared, and we are well prepared in terms of public health response, widespread testing, as you said, critical care, hospital capacity, and the capacity to manage outbreaks. And so I'm relatively confident, but one has to be. We don't know. It's a new experience for us, and so that's why we're very closely watching what happens as restrictions are released. And if we maintain the good control, that will give us increasing confidence over time. So I think we are doing the right thing at the right time, and this roadmap is good because it gives the states and territories the opportunity to perhaps go at their different paces depending on their local epidemiology, and we will watch and see, but we can't be absolutely sure what will happen.
I guess that's one of the merits of federalism. It does allow that experimentation and testing, and we can see which states are working well and working not. Thank you, Chair.